I'm Chavan Nikita. Today's my topic is the adverse event. Adverse event is the any towards medical occurrence in a patient or a clinical investigation subject administered a pharmaceutical product and which does not necessarily have to have a casual relationship with a treatment as per ICS 2. An adverse event can therefore be any unfavorable unintended sign, including abnormal laboratory finding, symptoms, disease, and means adverse event is means unwanted effect to from medicines, means undesirable effect occurrence. Then the unwanted effects is symptoms like headache, nausea, and then the physical findings elevated of BP, pallor or edema, and then the abnormal lab values, increased liver enzymes, decreased hemoglobin, and overdose important to find what percentage of cutoff to be taken as the patient. It can also be unfavorable deviations from baseline health, which includes worsening of conditions present, onset of body patients deteriorations due to primary disease, patient in intercurrent illness, and then the events related to possibly example as the are unfavorable deviations from baseline health, which includes headache present as baseline was mild now becomes severe. Then the worsening of condition present at onset of the study, unfavorable deviation from baseline health, which includes patient deterioration due to primary disease. Then the BPH study, patient going into acute retention of urine. Then the antibiotic study, URTI studies. Then the example of due to concomitant medications, hypertension trial, PT comes with diarrhea, interrogation had taken antibiotics because of URTI. Then adverse drug reaction is in the pre-approved clinical experience, defined all as all noxious and unintended response to a medicinal product related to any dose should be considered adverse drug reactions. All noxious and unintended response to a medical product related to any dose should be considered as adverse drug reactions. Means it has to be due to drug adverse reactions. The phrase response of a medicinal product means that a causal relationship between medical products and the adverse event. In a list relationship, reasonable responsibility, reasonable possibility, that is the relationship cannot be ruled out. Regarding regarding medicinal product adverse drug reaction in the post marketing setting at a response to drug is noxious and unintended, and which occurrence does not be. Then the unexpected adverse drug reaction means not mentioned previously mentioned and unknown response to observe. Then an adverse reaction, the nature or severity of which is not consistent with the applicable product information. Example, investigator brochure for an unapproved investigational medicinal product. Then the serious adverse drug events or reaction means untoward medical occurrence that any dose. And then in criteria include as a serious adverse drug reaction as life-threatening hospitalizations, result in death, result in a persistent or a significant disability, incapability. Then the congenital anomaly and birth defect, they requires requires inpatient and hospitalization. Then the suspected unexpected serious adverse drug reactions. Then the adverse reaction is means unexpected or clearly unknown and non mentioned, previously not studied on these reactions. Serious unexpected adverse drug reaction is one the nature's severity which not consistent with the information in the relevant source or documents, is not mentioned in any document. Then is a suspected unexpected adverse drug reaction. Then three types are then seriousness, intensity, and relationship of drug and unexpectedness. Then the serious adverse event or reaction is any untoward medical occurrence at any dose, result in death, life threatening hospitalization, result in persistent or significant disability, important medical event judged by investigators. Then the life threatening adverse event is the any adverse event that place the patients or subjects in the view of the investigator immediate risk of death from the reaction. It's as it occurred does not include a reaction had it occurred in more severe form might have caused death. Then toxic drug levels, infusion pump failure, excessive IV fluid dosing. Then disability, significant, persistent or permanent change, impairment, damage or a disruption in patients and structures have a physical ability to the or equality, and some stroke and stroke, loss of limb, toxic drug levels, hearing loss, blindness, overall the symptoms of the severe. Then the serious adverse event drugs important to medical event. Example of such event are intensive treatment and emergency room also present in this. Then the intensity is severity of adverse event. Then the three type of severity include then the mild, moderate and severe. Mild means awareness of signs, symptoms or event but easily tolerate, means it's can easily it's overly cure or prevent to any serious situation. Then moderate discomfort, cough to cause interference with visual activity and may warrant intervention. And the severe incapacitating with the inability to do usual activities or significantly affects clinical status and warrant interventions required. Thank you.